So the passage that we'll be answering some questions about today is from an article called What the Racial Data Show by Ibram X. Kendi from The Atlantic, April 6, 2020. Kendi writes, I dread every time my partner leaves our home. I dread every time Sadiqa marches to the front lines of the war against COVID-19, the emergency department. I dread every time she comes home and removes her personal protective equipment. Sadiqa is worried like a soldier in a total war, seeing so many medical providers going down, seeing so many patients going down. I am worried about her health and my own as someone surviving metastatic cancer. I'm worried about all medical providers as all Americans who have compromised immune systems, all Americans who are infected, all Americans who are healthy and want to remain that way. As a student of health disparities, I am especially worried about the well-being of people of color, and people of color appear to be especially worried about their own well-being. Black people at 46% and Latinos at 39% are twice as likely as white people at 21% to view the coronavirus as a major threat to their health. It could be some time before all or even most of the relevant agencies begin releasing racial data, but public health officials and medical providers like my wife are fighting COVID-19 now. People are sick now. People are on ventilators now. People are dying now. We need more racial data now. We need to assess the data we have right now. When I examine the trickle of data from states and counties on coronavirus patients, when I scrutinize the racial demographics of hotspots, when I study the survey data, it sure seems to me as if the viral pandemic is hitting people of color the hardest. In Michigan, Black Americans comprise 14.1% of the state population, but an ungodly 40% of coronavirus deaths. In Washtenaw County, home to Ann Arbor, 48% of residents hospitalized with the coronavirus are Black, though Black people make up only 11% of the county. In Illinois, the infection rate among Black Americans is twice their percentage of the state population. In North Carolina's Mecklenburg County, which includes Charlotte, Black people comprise 32.9% of the residents, but 43.9% of the confirmed coronavirus cases as of March 30th. In Milwaukee, Black Americans make up 26% of the county, but nearly half of the infections and a maddening 81% of deaths as of Friday. This racial pandemic within the viral pandemic is threatening Sadiqa's entire immediate family. She's more worried about her parents' and brother's health than her own. They seem to be well, but for how long? Just thinking about where her younger brother lives, where her parents live, makes us sick. They too are on the front lines of the deadly war. On April 1st, the New York Times released data on the number of coronavirus cases per 1,000 people for every zip code in New York City. Using Census Reporter, I studied the racial makeup of the zip codes with the highest and lowest coronavirus rates per 1,000 people in New York City. Queens zip code 11370 has the city's highest rate of confirmed infections with 12 cases per 1,000 people. The neighborhoods in it includes are 37% Latino, 25% white, 22% Asian, and 14% Black. In the adjacent zip code of 11369, which has the city's second highest rate of confirmed infections with 10 cases per 1,000 people, the population is 64% Latino, 15% Black, 12% Asian, and 8% white. New York City is 32.1% white, 29.1% Latino, 24.3% Black, and 13.9% Asian, according to the census data. But averaging out all the racial composition of the 5 New York City zip codes with the highest coronavirus rates shows a significant overrepresentation of Latinos at 45.8% and Asians 23.4%, and a significant underrepresentation of whites 21.2% and Blacks 8% when compared with citywide populations. Does this mean Latinos and Asians are being infected with and dying from COVID-19 at higher rates than other New Yorkers? We don't know for certain, but it sure seems that way. A recent Reuters IPSOS nationwide poll found that 16% of Latino Americans surveyed said they were infected, had been in contact with someone who was infected, or knew someone who was infected. compared with just 9% of white Americans. It is not a stretch to suppose that in our highly separated and segregated society, those results reflect different rates of infection in white and Latino communities. Some of the infected people whom Latino Americans know may be undocumented immigrants. In the United States, an estimated 11 million undocumented immigrants were already social distancing from the old virus of xenophobia that Trumpism has been spreading anew. They live in the shadows, mainly in California, Texas, Florida, New York, New Jersey, and Illinois, the very states, save Texas, that have some of the worst known outbreaks. But tracking and arrests by Immigration and Customs Enforcement, ICE, officers have not let up during the pandemic. The shadows may protect them from the old virus, but the shadows cannot protect them from the new coronavirus. And the convergence of xenophobia and COVID-19 has led to a horrible choice for undocumented immigrants. Do I or don't I come out of the shadows for my own good, for my family's good, for the greater good of the people who forced me into the shadows? Quitting low-wage jobs could mean getting deported. Getting tested could mean getting deported. Getting treated could mean getting deported. And if they are arrested, they could be thrown into ICE's network of jails and detention centers where the coronavirus is already spreading. Undocumented immigrants suffering from these impossible choices are not just Latinos. They are Middle Eastern, they are white, they are Black, they are Asian. In New York City, Asians are the poorest immigrant group. The number of Asian Americans living in poverty grew 44% from 2000 to 2016, according to the Asian American Federation. Perhaps their growing poverty helps explain the high infection rates in zip codes with large Asian populations in New York City. In the end, though, no group of Americans may be more vulnerable to COVID-19 than the incarcerated and the homeless. About 40% of people experiencing homelessness are Black, triple their share of the United States population. Brown and Black people comprise 56% of the prison population, doubling their combined share of the United States adult population. Homeless people may be the most vulnerable in cities like Seattle and Los Angeles. Prisons, jails, and detention centers have already turned into outbreak zones for prisoners, corrections officers, and prison healthcare workers. At least 167 inmates and 137 staff members have already tested positive for the coronavirus at New York's Rikers Island prison complex. And it is getting worse by the day. It seems as if every day now Sadiqa learns about another high school friend, another parent or uncle or aunt of a close friend who is infected, who is in the hospital, who has died from COVID-19. As of Saturday, Albany had 560 confirmed infections, including Sadiqa's best friend. Albany is what Sadiqa knows and no longer knows. My whole community is in shambles, she told me the other day. Sometimes racial data tells us something we don't know. Other times, we need racial data to confirm something we already seem to know.